If somebody has just an acute rhino nose sinusitis, sinus infection, do those usually need to be treated aggressively? How do you treat a common cold that goes with the sinuses?
A common cold, you would just give decongestants, and you hope that within 7 to 10 days the patient gets better. We certainly don't want to give antibiotics for colds because then you're just selecting out bacterial resistance and the antibiotics don't work well. And so we have a real caution in the medical community today to try to avoid immediate use of antibiotics because 80% of rhinosinusitis is viral, and those don't respond to antibiotic therapy, and that goes away on its own typically.
So we have to treat that symptomatically with saltwater sprays, with decongestants, with antihistamines, stuff to loosen up the mucus, and time.
Correct.
When do you make a decision on antibiotics?
Usually 10 days out. If the patient's not getting better or if they're worsening after that first week, then it's probably time to consider an antibiotic therapy.
Do you usually, if somebody's had the problem for 2 to 3 weeks, do you usually get a CT scan at that time, or do you start off with an antibiotic?
No reason to get a CT scan at that time. There's nothing that in that patient's history, if it's just acute, that would say we're going to have surgery. So the patient that needs a CT scan is that person where you're asking the question, is there some obstruction that might require a procedure that would allow them to get better? So that's the patient that doesn't respond to antibiotic therapy after several trials of prolonged antibiotics, or the patient who's experiencing recurring episodes of sinus infection in close proximity to each other.